Hello, my name is Emily. Welcome to my presentation on mental health and wellbeing in university students. This presentation will aim to answer the research question, what effect does university study have on mental health? Mental health issues are a large and growing health problem in Australia. The most recent national survey of mental health and wellbeing found that almost half of all Australians aged between 16 and 85 years will experience mental illness at some point in their life. This equates to over 7 million people. In 2018, it was found that 20% of Australians had a mental or behavioural condition, which is an increase from 17.5% in 2015. Nearly $10 billion was spent on mental health between 2017 and 2018. Mental and substance use disorders were estimated to be responsible for 12% of the total burden of disease. This places it fourth after cancer, cardiovascular diseases, and musculoskeletal conditions. Non-fatal burden of disease is a measure of the number of healthy years lost due to living with a disability. Mental and substance use disorders were the second largest contributor to this. The most prevalent mental illnesses in Australia are depression, anxiety, and substance use disorders. Now that we have an overview of the mental health status in Australia, let's focus on the mental health of a specific population group. University students have been found to have high rates of mental health issues in comparison to the general population. Headspace and the National Union of Students conducted a survey in 2016. They surveyed over 3,000 students from 70 university and TAFE campuses across Australia. The survey investigated how the experiences of students impact their time at university. They found that 67% rated their mental health as only fair or poor. 72% reported at least one day in the past month where they were totally unable to work or study due to symptoms of mental health problems. Most students experienced financial stress, with about 80% earning less than $400 per week. A minuscule 1.6% reported that no symptoms of mental health problems impacted their study in the past year. 2/3 of students found academic experiences in general to be very stressful, and 65% reported high or very high psychological distress. So, why is it that university students experience such high levels of distress? A number of risk factors make students particularly vulnerable to mental health issues. This includes academic pressures, where students may face large workloads, time constraints, and looming deadlines. They may feel the pressure of achieving high marks and worry about gaining employment following the completion of their studies. Financial pressures. The majority of university students are on a low income, as they tend to only work part-time or casually alongside their study. They may have recently moved out of home and lack money management skills. In addition to this, there are costs associated with university, such as textbooks, tuition, and parking fees. They may experience transitional stress between levels of education if coming into university from high school or even TAFE. It's a transitional period for many, not only in terms of academics, but self-discovery as well, coming into adulthood. Many university students have a poor quality diet. This is often linked to a lack of independent living skills and also finances. Being on a lower income means they often can't afford good quality, nutritious foods and go for the cheaper options, which tend to be high in sugar and saturated fat. Some young people might engage in risky behaviours such as drug and alcohol use, often as a way of coping with stress, but this can actually contribute to mental health issues. Students may get less than the recommended hours of sleep. This can be from a number of factors such as late night cramming, caffeine use, drug and alcohol use, computer use, increased socialisation, and juggling work and study commitments. And finally, relocation. So moving out of home, coming to a new city, state, or even country to attend university. They may have less parental contact than previously, leaving them vulnerable, and changes in their mental health. often going unnoticed. Mental health issues can impact many areas of a person's life, such as relationships, performance at work, and in the case of a university student, their study and academic performance. So, study can negatively influence mental health, and in turn, poor mental health has a negative effect on study. The students surveyed in the 2016 Headspace survey were asked which mental health issues impacted their study in the past 12 months, and the results are shown in this graph. The respondents included things such as thoughts of self-harm or suicide, a lack of energy or motivation, feeling anxious, a low mood, and trouble sleeping. The largest mental health issue found was stress. 83.2% of students said that stress had affected their study. So now, knowing that stress is such a large problem for university students, let's look at how it can be managed. The most effective method of managing stress will depend on the severity of the symptoms and the particular factors that are causing the stress. Some of the main coping and management behaviours and strategies are shown on this slide. The first is exercising daily, whether it be walking, attending a gym, or participating in sports. Eating a healthy diet, full of all the nutrients your body needs to be performing and feeling its best. Allowing yourself regular study breaks to relax the mind and then refocus. Managing time effectively, including making schedules and setting priorities. Sleeping a full 6 to 8 hours each night. Socialisation, so giving yourself time to relax and enjoy the company of friends and family. Mindfulness and meditation, so checking in with yourself mentally and allowing yourself to not think of study for a period of time each day. Mental health counselling services, which may be delivered by a university counsellor, a therapist, or even a psychologist. And finally, medication may be prescribed to those who are acutely stressed and not able to cope with it using other methods. A study published earlier this year found that the majority of students have poor practice of stress management behaviours. So, in that case, how can we reduce stress and improve its management in terms of public health? Health promotion strategies should target stress in university students. Governments should offer an allowance to ease the financial pressures of students. The Australian Government provides these benefits through Centrelink in the form of youth allowance for those under 25 years old or Austudy for those over 25. Perhaps the government should consider increasing this allowance, since students are still attributing financial pressures to be a large cause of their stress. Universities should also provide opportunities for a large number of students to access interventions. This benefits not only individual students, but has the potential to provide widespread benefits to universities in terms of both enhancing the student experience and reducing health service costs which result from student mental health problems. University students should be encouraged to utilise counselling services, as evidence shows the majority of students will see improvements in stress and mental health through using these services. Students should be offered time management workshops at university. These workshops should teach students how to effectively manage their study load alongside work and other commitments, and also educate them on how to best prioritise their university work. In a 2014 study, undergraduate university students undertook time management training. Perceived stress decreased and perceived control of time increased after the training, whereas their demands did not change. These results suggest that this type of training may be beneficial for their well-being. Group stress management programs have been found to assist students with discovering their preferred methods for self-management of stress symptoms. They teach methods such as diaphragmatic breathing and exercise. These programs have the ability to lessen levels of stress, anxiety, and depression. Universities should offer mindfulness programs or workshops. Evidence suggests that they should involve education about mindfulness and its relationship to stress, formal mindfulness meditations, and informal mindfulness practice, followed by a discussion about the experience of engaging in the practice. Students who participated in this type of program showed greater levels of mindfulness, self-compassion, as well as lower levels of stress. So, in conclusion, university can be a difficult time in a person's life, and there's a heightened risk of experiencing stress and mental health issues. This stress can be managed in a number of ways at an individual level, but there is also a responsibility at an organisational and government level. Universities and governments should implement a variety of health promotion interventions to reduce stress and promote good mental health to students. If you or somebody you care about is suffering from mental health issues, please reach out for help. There are a number of resources listed on this slide. The next two slides contain references that were used in the development of this presentation. Thank you for watching.